Okay. Thank you, Dr. Manish, and good evening.
Thank you, sir. Thank you.
Good afternoon and good morning. This is the 1181st day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Poonam MEGHHANI from Rajkot, Gujarat. Let us begin the session with 1 minute silent prayer. Thank you all. As you all know, the International Forum for Promoting Homeopathy is conducting a regular session from 7 to 10 p.m. regularly. And today we have our English session just closed now, and our international session is about to be already began. And our guest is Dr. Poonam MEGHHANI from Rajkot, and she is a wonderful personality from that area because this is the fourth consecutive doctor from the Rajkot Homeopathic Medical College here to present a session. That itself indicate how these people are really good, and each and every presentation from them are really excellent. And today she will be discussing about LEUCORRHOEA. As you all know, that LEUCORRHOEA is a subject which is a very, very important as far as homeopathic doctors are concerned. Most of the, there is a proverb, there is no man without piles and women without LEUCORRHOEA. That means that almost all girls have this LEUCORRHOEA, but the intensity is different. And of course, we need to discuss all these things, what are the causes for this LEUCORRHOEA and how it can manage, and what is the effect of homeopathic medicines on this disease. Before that, let me introduce the details about our guest that is Dr. Poonam MEGHHANI. She is the assistant professor and Department of Gynecology and Obstetrics, and she has completed her BHMS from Rajkot Homeopathic Medical College itself, Saurashtra, and MD in Repertory from Ahmedabad Homeopathic Medical College, and M.Phil from Department of Statistics in Saurashtra, and PhD. She is also doing a PhD from the same college. She has been working as an examiner as well as a paper setter for different universities, and she has participated in seminars and conferences and workshops. All are very good for a homeopathic doctor to bring the best to the for the system of homeopathy. And she is working hard, and she had made different presentations also. All these presentations are really excellent, and as I am not going about the details about all those things because she has to say a lot of things to us, and we are anxiously waiting for the presentation. And yesterday we have excellent another session from her husband, and today let us welcome our chief guest of the day, Dr. Professor Dr. Poonam MEGHHANI, to the stage. Welcome, madam.
Good evening to all, and heartfelt thank to all the members who had given opportunity to handling this kind of presentation. So let us begin. We are not going.
Yeah.
Okay, shall we begin? Our today's topic is efficacy of homeopathy in management of LEUCORRHOEA.
Doctor, have you started sharing?
Yeah.
No, please reshare.
Yeah.
That's not visible now. Yes. Now it is okay.
Yeah.
It's fine.
So we'll begin with the introduction first. As the LEUCORRHOEA is a wide, I cannot say it's a disease, but it's a wide range of symptoms. It's a manifestation of some disorders as a woman feel, or once in a lifetime, each and every woman has feel that symptoms, right? LEUCORRHOEA is not a pathological condition, it's a physiological condition, and it's a medical condition where women experience thick whitish discharge, or it may be different in color, yellowish discharge from the vagina, which mainly experienced during the puberty. It specifically depends upon the hormonal changes. The main hormone behind this is estrogen. Estrogen is highly responsible for creating this kind of discharge that will increase the production of cervical glands, and the cervical glands started discharging, and that discharge come out to the vagina, and that's the leukorrhea. Normally, in majority of the cases, especially estrogen disturbance occurs during the time of puberty. As the estrogen started rising, it's the main primary female sex hormone. It starts rising because of ovulation, and during that, the reproductive system get activated, and because of that, each and every girl uh, feels or possesses some kind of discharges, and that we call leukorrhea. Every woman have periodically some normal vaginal discharge, which will maintain the normal health of vagina by chemically balancing the structures and defense mechanism or defense system of vagina as they flush out the dead cells, the reproductive organs, and the toxic organisms from the vagina itself. If such discharge are not normal, that means if they exceed or that will disturb the normal day-to-day life, or they containing some smell, or they containing some kind of specific colors, then that will not be normal. That is, that may be because of some sign of infection, or that may be because of some disorder. If that is thick, sticky, white, or normal discharge, then on that periodically, the medical checkup is required. If any changes in color, that medical checkup is required. And if it is profuse, more than a normal quantity, then definitely a female should consult a doctor. Now we'll move forward towards the etiology. What are the causative organisms, or which are the things which will creating this kind of symptom? The major cause, as we have discussed, the normal physiological changes, that is, increase the amount of estrogen in the body, specifically uh, during the time of puberty, during the time of menstruation, or during the time of pregnancy. These are the normal states where the normal amount of estrogen is increased by double or more than a double. So these are the normal changes where each and every female will have a symptom of leukorrhea or increased discharge in that. We'll move on to the other positive factor, which we call the pathological factor, which is the probable cause for creating leukorrhea. The first and foremost was spread of infection from the urinary tract. Usually, uh, because of less habit of drinking water, or especially in case of summer, the water amount is taken which is less, so that will create UTI, and because of that UTI, the infection will spread towards the genital organ as the vagina is nearby. Next thing is the reproductive organ. For example, uterus. Any kind of inflammation or infection in uterus that will transmit towards downward, and that creates the leukorrhea or pathological variety of leukorrhea. Some specific infections like bacterial, fungal, parasite, that all are creating a different pathological leukorrhea. And we have already discussed the physiological criteria, that is nearly young age or the pubertal age, or specifically pregnancy, before the age of menopause, that is the typical state of hormonal imbalance, where a woman can feel the symptoms like leukorrhea. Injury to the vagina, womb, or cervix. Any kind of injury that may be lacerated, or during any operative procedure, that injury will create infection, and because of infection, the leukorrhea may generate. PID. It's a broad spectrum, I can say broad spectrum term for creating any kind of leukorrhea, as it will generate inflammatory condition into the vagina also. One of the major thing in case of the younger generation, I can say 30 to 40 years of age, that is contraceptive use. Contraceptive use, specifically IUD, intrauterine devices, that are creating the media for traveling infection from lower genital tract to the upper genital tract. And because of that, PID will generate, and because of these all things, leukorrhea get chance to develop. Lack of cleanliness, poor hygiene, specifically during the menses or before and after the menses, or in the older age, displacement of uterus or any ligamental changes, prolapse of uterus, these all kind are creating a pressure on the cervical glands, and because of that, cervical glands started discharging more, and that will create as a leukorrhea. Infection through meadow, any fungus like, for example, yeast infection. Uh, in the reproductive organ that will create leukorrhea, and this discharge will be thick white and which create itching in the vagina. This kind of discharge is called vaginal widow. And vaginal yeast infection, that is also called vaginal candidiasis, one of the kind of infection of vagina, and which create thick white vaginal discharge with having potted cheese like, often attended with the burning or itching sensation in vagina, and it also leads to vaginitis along with the thick discharge. Bacterial vaginosis. It refers to the vaginal infection which is arising from the overgrowth of bacteria which is normally residing into the vagina. And this overgrowth will create some foul smell, discharge, fish-like odor, and that may be greenish, or grayish, white, or yellowish in color. Some of the major causes, that is STD, sexual transmitted disease, that also causes the leukorrhea. And one of the most common example is chlamydia trachomatis. That is the STD caused by bacteria, and that will create vaginal discharge, painful urination, burning and itching in vagina, greenish yellowish discharge, and painful intercourse. Same likewise gonorrhea, which is caused by bacteria Neisseria gonorrhoeae. It leads to the profuse vaginal discharge with yellowish to greenish in color, with pelvic pain, irritability in urination, vaginal bleeding between the periods, and so many. Trichomoniasis and genital herpes. These two are the parasitic and the viral disorder. Trichomoniasis is caused by parasite Trichomonas vaginitis, and that cause foul smelling vaginal discharge, which is yellow to gray in color or whitish in color. Now, genital herpes, that is caused by the viral disorder, that is herpes simplex virus, and which is creating the soreness on the genital region, having a heavily itching and foul smelling discharge with painful urination. So the problems related to last part of the womb, specifically any blister or swelling at the head of the womb, the body part of the womb, it may cause leukorrhea. Some general physical illnesses like malaise, anemia, these all are heavily use of antibiotics or steroid or birth control pills even. They create disturbance in the hormonal, specifically estrogen, and then they are responsible for developing leukorrhea. Douching, that's the vaginal wash or with the mixture of some fluids with the water, and that specifically use scented soap and bubble bath that will enhance the media for developing infection, and then it starts developing leukorrhea. Inflammation, any kind of inflammation below the abdominal region that is containing any organism, and that may responsible for creating leukorrhea. Specifically, dirty toilet use, commonly the public toilet. Public toilet is commonly used by the female, and at that place, if the place is not that much clean, the infection transmit to the one woman to the other woman, and that is creating leukorrhea. Stress or depression. This is one of the major symptom or major problem creating the leukorrhea, as the nowadays stress and depression are increasing day by day. The woman is so much under pressure Though there is no pathological condition is responsible behind that leukorrhea, but some psychological factors are also responsible for creating leukorrhea. Those who are having hectic schedule, depressed life, psychological factor, family, and this all will create a psychological effect on the female's mind, and that is also responsible some kind of increased discharge from. Some surgical events like post surgery, any kind of pelvic infection, or any surgery after that PID, and that will lead to leukorrhea. Diabetes is one of the things where it is having a risk factor for developing leukorrhea. High level of sugar will increase the metabolism of any kind of bacteria and parasite specifically, and that will lead to uh, develop leukorrhea. Vaginal atrophy, specifically thinning and drying of vaginal lining, that will noted unusually during the menopause, and that will enhance the developing of bacteria and create leukorrhea. Vaginal fissura and vaginitis, and rarely the carcinoma of cervix or vagina, which may create some kind of discharge. Now we move on towards the pathophysiology. What are the main basic pathophysiology behind developing leukorrhea? So physiological basic involved in normal vaginal discharge that depend on the level of endogenous estrogen. Endogenous estrogen, which is already present in our body, but it rising its level because of some uh, changes during the pubertal age, during the pregnancy, and that will lead to increase the secretion of cervical glands, and that cervical glands will secrete where it is in vagina. So vaginal epithelium become very rich in glycogen. This mucus secretion from the cervical gland normally small in amount, and that means secreted cyclically when the estrogen is higher in amount in our body. But when it starts secreting more, and that glycoprotein used in split off and fermented into the lactic acid. So if mucus is secreted in excess, that is all pour out into the vagina, and outwardly the patient expresses as a discharge from the vagina. The excessive secretion is because of either physiological excess, that is age-related changes, puberty, or pregnancy, or just before the menopause. Then cervical cause, specifically cervical leukorrhea, that is increased secretion of the cervical gland, and sometimes because of pathological conditions, for example, vaginitis, that will create discharge increase from the vagina. Now, when we find the physiological excess is normally the higher level of estrogen. Okay, this condition is normally seen during the pubertal age, where the endogenous estrogen is very helpful in overgrowing the epithelium of ovary, and which enlarge into the cervical, and that cervical glands producing congenital ectopy. Congenital ectopy, that's a kind of erosion where the cervical cells, specifically external os, will increase in inside, and that will create increased secretion. During menstrual cycle, around the ovulation, the estrogen level is at peak, and because of that, increased secretion of cervical glands are activated, and through that, the vaginal secretion is increased. Pregnancy. Pregnancy is the state of hyperestrogen with increased vascularity, and this will lead to increased vaginal transudation and cervical gland secretion. Another one physiologically, we can say during sexual excitement, when there is abundant secretion from Bartholin's gland, that activation of Bartholin gland secretes more cervical fluid, or activate the cervical gland to secrete more cervical fluid, and then it leads to discharge into vagina. Now come to the cervical force. So there are non-infective and infective variety. If there is infective variety where the cervix is become infected, either there is a chronic cervicitis or mucus polyp or any kind of cervical ectopic. Vaginal cause we have already discussed, that is either retroverted uterus or vaginitis or any kind of PUs. PUs will creating vaginal adenosis, and that will create a most important cause for ill health of vagina and will lead to excessive vaginal discharge. Now, what are the symptoms of leukorrhea? Leukorrhea, the word itself says white discharge. But what is exactly the symptoms of leukorrhea? It's not exactly patient will tell us that I have white discharge. There are lots of symptoms are associated with leukorrhea. Either we can say these symptoms are responsible also sometimes by creating leukorrhea. For example, anemia. Anemic person is always having ill health, and because of that, the low amount of hemoglobin level that will create physical ill health and which lead to leukorrhea. Constipation. The person is having strain for constipation. Because of that, the glands are activated and the person is having leukorrhea. Pain and heaviness in lower abdomen. Polyuria, specifically when there is a female having UTI, is one of the main causes for leukorrhea. General weakness and malaise, anorexia, pain during menstruation. These are the frequent symptoms which are seen in patient of leukorrhea. Headache and dizziness. This is one of the factor where the leukorrhea uh, person is admitted that they have headache, dizziness, indigestion, or sometimes breathlessness. Basic thing is the person who are very weak by physical structure, they are more prone to having leukorrhea in their life. Now, signs and symptoms which we have discussed. Now, how will come to know that the vaginal discharge is normal or abnormal? We have primarily mentioned that the leukorrhea, that means whitish discharge, but the discharge which doesn't having any color changes or any smell or normal in consistency, that is the normal. For example, clear. The clear variety, that is a clear variety of the discharge, that is healthy discharge. It may be seen during pregnancy, during the ovulation, during hormonal imbalance, and so whitish discharge. Sometimes whitish discharge is also healthy, and if it is small in amount and it is not seen frequently, then it's normal. But if it is seen frequently, it changes from whitish to curdy to yellowish in color, then it may be yeast infection, which we already discussed. Grayish leukorrhea. That specific color discrimination for that is given, that gray leukorrhea or whitish to grayish in color, that is a sign of bacterial vaginosis, having some foul smell, and it is more profuse in color. Now, yellow to green in color. We have already learned that during any STD, any kind of STD variety, having yellow to green in greenish discharge, having foul smelling, profuse in consistency, and it is always associated with itching in vagina and lower genital tract. Pinkish. It's not exactly pink, but the pink tone of red or mixture of gray and red in color. That's because of cervical bleeding or any vaginal irritation, forceful sexual intercourse that may create pinkish discharge, implantation bleeding, specifically when we are inserting intrauterine devices into the cervix. So at that time, after that, for a few hours, there is a pinkish discharge, and this is because of IUD. Red discharge. It may be, we can say, a triggering sign for the leukorrhea, except with menstruation. Menstruation is obviously red, but some kind of cervical infection or bleeding from cervical polyp or endometrial or cervical cancer. Specifically, after the age of menopause, if the person is coming with the reddish discharge from vagina, that is the triggering sign for the carcinoma. the different color consistency we have discussed. The same slides are there. Now, except the color, some consistency are there. For example, curdy cream, milky white discharge. Right? So this is the thin consistency. It's orderless, curdy, cheesy, or milky white in color. That can be because of vaginal flush, and that might be a normal. That is orderless and few in quantity, and sometimes it disappears by itself. Clear vaginal discharge. It's orderless, it's continuum out, and it doesn't cause any kind of symptom like itching or staining into the linen or any kind of disturbance in physical life. Yellow vaginal discharge. It's a trigger sign of infection, as the yellow color is because of the pus mixed with the vaginal mucus. Green vaginal discharge is the sign of bacterial infection, specifically sexually transmitted disease, that moreover yellow to green in color or the mixture of yellow and green in color. Bloody vaginal discharge, that indicates the problem anything more than a warrant, specifically trigger factor to the females, and we have to call for the doctor. Red vaginal discharge, specifically menstruation, is the normal one, but if it is seen postmenopausally, it is cervical cancer sign or endometrial cancer. Pink vaginal discharge, that signifies it doesn't necessarily mean anything is wrong, but you should consult a doctor once in a while if you find this kind of discharge. Brown vaginal discharge. The brown color is because of clotted blood with the mucus, so that indicates the reproductory tract bleeding, or that bleeding mixed with the vaginal mucosa, and that degenerated and gives brown color. Gray vaginal discharge, specifically thin grayish in color and fishy smelling discharge, that signifies the infection of bacterial vaginosis. Watery vaginal discharge, specifically with itching, it is seen, then it is vaginal candidiasis. Smelly vaginal discharge, if you feel foul smelling in the discharge, that may be the indication of infection in the cervix or the vagina. Now, how will diagnose? These are the different kinds of symptomatology we have learned, but how we can diagnose the patient of leukorrhea? Because leukorrhea is not a disease; it's a symptom, and sometimes that symptom gives us a wide range of disease symptoms along with that. So, how will diagnose? The patient usually complaining for abdominal discharge from vagina, either it is associated with the disease symptom or it may not associated with disease. Discharge look white, creamy in color, sometimes reddish or blackish or yellowish in color. General weakness is most of the time associated with the cases of leukorrhea, which reveals the ill health of patient. It may be because of leukorrhea or that's vice versa. If the person is already ill health, that may create leukorrhea, and the person is having leukorrhea, and from so long, if she is having leukorrhea, the health, normal health will also deteriorate and the patient become ill. Irritability is always seen in the patient's nature, and that hastiness and irritability will lead to a risk of heart attack also. The discharge is subjected to microscopic examination for detection of pus cell to exclude the infection nature of disease. If pus cell is not detected, then it is the case of normal leukorrhea. But if pus cell is detected, then it's a variety of pathological leukorrhea, and we have to find out further on the pathological organism which is responsible of creating that kind of leukorrhea. So the diagnosis portion, history is also important. As well taken in homeopathy, we say that well taken history is the half of the cure or half of the case taken. Right? So if we take the history properly, then how it begins, the duration of complaint, if kind of infection is there, excessive sexual intercourse is there with that female, specific characteristics, when the discharge increase, when discharge is seen more, whether it is seen normally or it's abnormally high in amount. So this kind of history will help us in diagnosis for specific condition. Then for the special examination, you take smear from the urethra, vagina, and cervix all together, and we have to send for the sample. Third urine examination obviously are helpful to the case, and BP examination. Blood pressure sometimes reveal the stress criteria. If the blood pressure is high, then person is always in stress, and that is one of the cause for leukorrhea. So we have to treat the case accordingly. Now, how it is transmissible, right? We have discussed that the leukorrhea is a normal thing, but it is transmissible also. Leukorrhea is transmitted through medial like yeast, transmit from the woman to woman, specifically when the women are using public toilet. Therefore, the transmission will be more frequent. Then intermixing of clothes of affected women to the healthy woman, that is also the infection. Some un- undergarment wash regularly, which create a good, healthy uh, woman lifestyle. It may be created by unprotected cells, sex, so that should be limited. Now, principal management of leukorrhea. How will management the cases of leukorrhea? So, if leukorrhea is because of weakness, the nutritive power of the person should be increased, and that will also increase by giving an apple a day. There is one sentence like an apple a day keep doctors away. But here we need to increase the nutritive power by giving easily digestible food and beverages that will increase the nutritive power of uterus and cervix and vagina, and which will lead to normal development of gland and less amount of hormonal control. If the leukorrhea is caused by any kind of infection, then infection should be treated. For example, it's anemia. Anemia is not infection, but iron compound is deficient, and because of the deficiency, the person is ill health, and that should be treated by giving iron supplement. If the person is generalized weakness, then generalized tonic should be given. If the person is having any kind of upper genital tract infection, specifically uterus metritis or cervicitis, then it should be treated accordingly. PID, that should be treated accordingly. The maintenance and strengthen all vital organ of the body. That will improve the general health of patient, and leukorrhea will automatically improve by then. Sympathetic attitude must be kept toward the patient, while the anxiety state should be removed if patient is anxious. We can have a good talk with patient, which relieves the anxiety of the patient. Look, uh, loose fitting undergarment, preferably the cotton, which will allows the aeration movement, or which keeps the area aerated, and that will create a less kind of vaginal tract. Local hygiene, specifically during menstruation, should be well cared, as it will always ins- stimulate the transmission of leukorrhea. Previously, some home remedies were used in the treatment of leukorrhea, like Indian gooseberry. Should be taken, 1 teaspoon of Indian gooseberry should be taken with the 1 cup of water until the water reduce, and that will give strengthen, and uh, that will also strengthen our immunity, and it will reduce amount of leukorrhea also. Now, some diets are there which will work as an anti-leukorrhea diet, right? There is no, not specifically diet, but because of positive organism, we can create some diet. For example, sugar. The person who was having discharge because of diabetes, we can control the amount of sugar. Sugar means all sweet items, that's ice cream, custard, whatsoever. We can control that, and discharge will be automatically controlled because of that. Mushroom should be avoided when the type of leukorrhea is mildew. Little modification in that will help in prevention of the leukorrhea, as well as it will also modify the amount of leukorrhea, specifically unhealthy diet is there in the meal, then that will create a more amount of leukorrhea. Now come to the homeopathic point of view. Homeopathy is can be proven as an effective method of treating leukorrhea, as is not only emphasizing symptoms, but it is treating the person as a whole. We all homeopaths believe that we consider the person as a whole. So we cannot take a symptom of leukorrhea of that female, but we read the mind, full mind of that female, and we treat accordingly. So the along with the symptom removed, the physical and mental health of person is also improved. So, for example, the disease reaction of the patient is because of unfavorable environmental factors. So, this fact, unfavorable environment will manifest through the signs and symptom pattern of the reaction, and that signs and symptoms will give us a totality of symptoms. Now, according to the mathematic analysis, we can divide the leukorrhea like a psoric leukorrhea. Psoric person is having leukorrhea specifically much more than a stigmata or with the less apparent cause. There may be no causative factor behind the psoric leukorrhea. There is a thin, moderately thick or whitish albuminous odorless discharge. It is watery in amount, bland, scanty. Leukorrhea may not be exhausting. Person is very healthy, not particular about color or odor. The reaction of the test will be neutral, and the quantity may be profuse or sometimes it is less. Leukorrhea of pseudosora person is purulent, sometimes thick yellowish or whitish in color, and is always associated with weakness before or during the menstruation. Psychotic leukorrhea. Psychotic leukorrhea is acrid with the weakened patient, smells like fish brain, with mental weakness, and during leukorrhea, characteristic of the leukorrhea, psychotic leukorrhea, that is thin, dirty green water, sometimes greenish yellow is scanty in color, producing biting and itching of burning vaginal parts. Patient taking douches on account of odor and acridity of discharge is also present there. Reaction is moreover alkaline, and the quantity may be thin, scanty, stringy, or it's very tough to wash. It is having not washed off easily. Syphilitic leucorrhea is greasy in consistency, it's brownish in color, offensive, and it's having acidic reaction, excoriating the parts, specifically excoriating undergarments, the holes in the undergarment, and that eroding the line. Quantity, moreover, it's copious, uh, lots of them in amount. Tubercular leukorrhea. The tubercular patient is having nourishing diet, plenty of fresh air, and sunshine, exercise, appropriate bathing, and anything that will restore the vigor amount of system that will create a leukorrhea. Now we'll move on towards homeopathic management of leukorrhea, as one of the fine remedies are given in homeopathic management, which will create drastic changes and miraculous result in case of leukorrhea. Our first medicine is alumina. Alumina should be applied to the corticals, transparent and yellowish leukorrhea in color, very profuse in amount, droppy consistency, and great exhausting. Aluminum female is always exhausting with any kind of symptom. Very rich in albumin. Leucorrhea is very rich in albumin. It occurs chiefly in the daytime. Great profuseness and bad constipation is the characteristic of aluminum. Though the person is having soft stool, it has to strain a lot. Arsenic is the acrid thin offensive discharge, burning with red hot iron. Though we can not see that particular symptom, but we have taken the particular symptom of leukorrhea of each and every medicine. Otherwise, we can take the totality of symptom along with the leukorrhea in each and every. So stitching pain in pelvic region extending to the thigh, all complaints will was on list exertion. Patient is exhausted both mentally and physically. So here the stress is also applicable along with leukorrhea. So arsenic is a very good medicine for that. Thirst quantity, thirst of large quantity of water at frequent interval is one of the key feature of arsenic. Borax. Clear, copious, and albuminous leukorrhea is one of the key features for borax. Leukorrhea with the sensation as if warm water is flowing is the keynote of leukorrhea in borax. Leukorrhea between the menses with great nervousness and white as starch perfectly banned without pain. Leukorrhea without pain, one of the good medicine is borax. Men too profuse too soon with nausea is also associated in borax. Colophylum specifically indicated in the leukorrhea of the little girl, which is having very profuse weakness and very weak child. Calcarea car, though for the calcarea we can say the main symptomatic general symptomatology is applicable more as the patient is parapatiplegic. So patient is correspondingly profilus diathesis, they're having profilus diathesis, enlarged cervical gland, and obviously the leukorrhea is profuse, milky, white, yellowish, accompanied with the itching and burning. It's specifically suitable to young girls just before the puberty. Conime. Conime is a special narcotic to the genital organ when we have uterine colony connected with the leucorrheal flow. Menstrual tympanitis, aching pain in the hypogastrium like menstrual colic. This is key feature for conime. Uterine prolapse and bulbar eruption is also one of the causative factors for creating leukorrhea in conime. Calcarea course is very fine remedy for scrophulous diathesis, profuse, milky, and blend variety of leukorrhea. Haloneus for the profuse, thick, yellowish leukorrhea, which creates some irritation and itching in anemic person, specifically with the prostration and general debility is more. Hydrostic is one of the fine remedy for tenacious thick crappy leukorrhea with the erosion of cervical cervicitis. And this leukorrhea is profuse and debilitating corresponding to the hydrostic. Calibacter, a yellow ropey strange leukorrhea and having associated with the features like calcarea carb, like that spare light hair and petechial. Lilium tick, very good remedy for the young girls having coagulating watery yellowish brown leukorrhea and profuse in amount and having a depression. Psychological effect is more seen in case of lilium. Magnesium muriaticus, specifically leukorrhea after every stool. And every uterine spasm is there after every stool, and that will create discharge from the vagina. Leukorrhea after 2 weeks of menses, cramp-like pain is more specification, and cramp-like pain, especially when the movement preceded by cramps in abdomen. Mercurius. Mercurius is the king of the breed, right? So acrid excoriating leucorrhea, smarting and burning in nature, swelling of external genital organs, itching, irritability. These are the main features of leucorrhea. And typical discharge is that is purulent greenish yellowish white in color, which is aggravated at night because of heat and tenderness and pain involving in the Neptune gland. Lilium tea, we have discussed. Natromure. Natromure is one of the remedy where the main factor behind the leukorrhea is debilitation. Debilitation in kind of any nutritive deformity or with the headache or it is more of a yellowish color seen on the face and leukorrhea is white thick in color. Leukorrhea specifically first it was white and then it turns green, then natromure is indicated. Nitricum acidicum, specifically nitric acid, cherry brown and pitted leukorrhea. That's the typically leukorrhea of nitric acid, where syphilitic patient is there, consisting mucus in the leukorrhea, which is drawn out. The inguinal glands are sympathetically affected in case of leukorrhea, and there is offensive catra in offensive leukorrhea, offensive breathe, pitted stool, sweat, everything is pitted in case of nitric acid. Pulsatilla, one of the finest remedy for mild gentle lady, that's milky leukorrhea which become watery and accrete from the retained vagina, that disposition to lie down, dullness very marked, mild yielding female irritability because of desire for fatty rich food and which aggravates the condition. Sabina is good medicine for bloody leukorrhea, specifically when suppression of menses is there and that will create bloody leukorrhea with offensive and smell along with it. Sepia. We can say the sepia is washerwoman remedy, but the leukorrhea of sepia is yellowish to green in color, offensive, very excoriating, will burst before menses. It's associated with the itching in vagina and pain in abdomen. The patient has a shallow pimply face and it's more suitable for who are having that complexion. Silicea is one of the best remedy for the person is having leukorrhea just when urinating or after menses. Leukorrhea is milky, floating at interval and preceded by gripping umbilical region. Constipation and before and during menses, there's typicality of lesion. Sulfur is always complaints are relapsing. If one complaint started and the another complaint returned. So aggravation before, during, and after menses, that's leukorrhea. Headache and leukorrhea alternate. Just either headache starts, then leukorrhea, and then headache. So before menses, there is headache, itching in parts, non-osmotic colic, inadequate cough, and leukorrhea sometimes corrosive, gnawing, yellowish, and preceded by the pain in abdomen. Graphite is typically used for the menopausal age where lady look like very excoriating. The leukorrhea is very pale, clean, profuse, whitish in color, and weakness is most symptom along with the leukorrhea. Calicar, whenever leukorrhea is associated with labor-like pain, and that is associated with itching and burning, and the leukorrhea is better by washing. One of the key features for calcarea carb is calicar. Lecasis, where the leukorrhea is copious, smarting, staining, and it will stiffen the linen, specifically greenish colored linen stain, and that will make the linen stiff. This is the key feature for the lecasis in case of leukorrhea. Lycopodium, specifically periodical leukorrhea, milky white in color and worse before food. Some of the repertorial approach of leukorrhea where almost all key medicine are represented. This is all about the features of leucorrhea.
Really an excellent session, Dr. Poonam MEGHHANI, and you have shown beautifully how leukorrhea develops and what kind of this the leukorrhea can be called be disease leukorrhea and what is not uh, uh, really a disease problem. And there is a confusion among people that all leukorrheas are disease person.
Yeah.
But naturally, it is a natural
Symptom.
as
Symptom.
yes, as you rightly point out, it is a part of the symptom, but it may not be a part of disease. Anyway, almost all medicines you covered in this session, and I think it is a time for discussion. And those who want to have discussion, please come up with your question and suggestions, and of course, you can make your opinion also. Yes. Doctor, how many patients are you people getting in your hospital for this gynecology department usually?
Lots and lots of, because now onwards patients are turning towards homeopathy. Though
Yes.
they are taking allopathy, but for small symptoms also they are taking homeopathy, and that's a good sign for homeopathy.
What kind of propaganda you people make to the public that uh, homeopathy is a big science and which can make a lot of wonders in all kind of diseases?
Look, patients are nowadays tired with the allopathic medicine. As they are taking the medicine for a few days, they get relief, and then the symptom are worsen, coming with the worsen probability. But we convince the patient that homeopathy is, though it takes time, but it will give you a permanent cure if you take it regularly on for each and every symptom. It is not like that homeopathy is only for the chronic disease. Homeopathy can also works good with the acute disease also. So now patients are more convinced towards acute disease also. For simple cold and coryza, now people started taking homeopathic medicine, and that's a good sign for a homeopathy.
What kind of result you are getting in infertility cases? Because infertility is
Yeah,
one.
infertility is a wide range, and along with we are going for allopathic investigation also. And though there are no cause in allopathy for the infertility, but then also a person is having infertility, and we are having some good results with infertility of case also.
But
I'll discuss one of the my case.
in Kerala,
And yeah,
we have infertility center in our government
in
homeopathic
our school,
schools.
in our college also, we are running one infertility clinic.
Uh,
Specifically on some specific days of the week where we see only the infertility cases in homeopathy.
and what is the success rate you people are getting in your hospital, and whether you are able to publish all those things in the media? So because the media is the
Yeah, that media is such a thing that one success case will give us a five new patients. So we are getting success by the end of 3 to 6 months. Almost 50 to 40% success rate is there.
Definitely, we need to bring all these things to the
But
public.
yeah,
In Kerala, at Kerala, we have more than 1,000 doctors in government sector,
yeah,
and all are getting very good result in all kind of diseases, and they are using these. Homeopathic medicine is a big thing as far as these people are concerned. They are getting wonderful results nowadays
yes,
with homeopathy.
yes.
And what kind of support you people are getting from the government sector? Whether how many government hospitals or dispensaries are there in Gujarat? Because Gujarat is supposed to be one of the place where a lot of homeopathic hospitals in medical colleges are there.
Yeah. Uh, Our is the private university, and we are getting support from our university itself also. So government support is also there with some universities, but I can hope that still government can improve more homeopathic centers along with that, so patients get more benefit to that.
Yes, definitely. You people need to bring all these things to the notice of the government,
Yes.
Particularly the Kerala model in health sector.
Yeah, that's very good.
Because you will have to find this, that and bring the notice of your health minister and the chief minister so that they can do such wonders with this homeopathy, and then definitely more people will come to the government hospitals and more doctors get a job
Yes.
in government sector, and
Yes.
that and they can become gazetted officers also. So that will be the best sign for the betterment of homeopathy.
In our college, all OPDs are run with free of cost, as the university supplies all funds and all. So we have almost 80 to 90% cases along with the normal cases, gynecological cases are.
Okay, anyway, it's really a very good session. I think our Dr. Patmapriya is here. Doctor, can you say a few things about her Dr. Poonam's presentation, and you can say the vote of thanks to the session also, if possible. Dr. Patmapriya, please unmute yourself. If you are driving, if possible, you can unmute and speak. So I think it is some of the foreign doctors always there, but today I think Dr. Vaidehi Bhatt is there. Dr. Vaidehi, please say a vote of thanks to our guest today. Please unmute.
Sorry, sir.
Yes,
Good evening, sir.
yes, sir. Yes, doctor. You can say the vote of thanks to your friend here.
Yeah, sure, sir. Uh, thank you, Poonam Didi. Thank you so much for this wonderful session, for giving such a knowledge about the various drugs indicated in leucorrhea. Even Poonam ma'am is taken leucorrhea topic in our college, sir. And she is taking very good therapeutics and case and indicated remedy and particular case. So thank you, ma'am. Thank you so much. Thank you, sir. And thank you for this IFPH platform for providing such opportunity to every doctor to share her or his views regarding this.
Thank you, Dr. Vaidehi. And now it's
Thank you so much, sir, and the whole team.
Definitely, we are expecting more presentation from the doctors from Rajkot Medical College, because all of you are really big fellows as far as the homeopathy is concerned, and your presentations are really excellent. Hope we can have some more presentation in the future. And with that, we come. Thank you all. And with that, we come to the end of the session. And now it is the time to begin the Malayalam session, which is over to Dr. P. Shaila.
Thank you so much, sir. Thank you. Bye-bye.
Shaila Doctor, co-host Amallo. Please unmute. Doctor co-host.
Okay. Thank you, Dr. Dhanesh. എല്ലാവർക്കും നമസ്കാരം. ഇന്ന് IF